Hello, everyone, and welcome to today's webinar. And we're going to talk about non-invasive, non-surgical solutions for knee pain. And my name is Dr. Jade Millay, and the name of our facility is Apex Physical Medicine. You'll always see, hopefully throughout the webinar, our contact information. You can always contact us by phone or by going onto the web address you see there. So I hope today you'll learn something new about how to treat knee pain in the next 20 minutes or so that we go through this webinar. So we're going to cover three critical components of how to treat knee pain, which is mainly from arthritis. Our purpose is to help people as much as we can through non-invasive means for knee pain, knee osteoarthritis, which can lead to loss of mobility, also arm, leg, and hand pain and foot pain, sciatica, which is that searing pain coming down from the back into the buttocks down to the leg, back pain, hip pain, shoulder pain, and arthritis and joint pain. So our approach is a multidisciplinary approach. We have medical doctors, physician's assistants. We also have a nurse practitioner, and we try to stay on top of things and use the most advanced treatment technologies. We also have chiropractors. We have a diagnostic center, and we treat knee pain and arthritis and also neuropathy. So we try to use a multidisciplinary approach to getting you better as quick as possible. So some simple facts about knee pain. There's about 100 million people, Americans, that have chronic knee pain in comparison to diabetes, where there's only 26 million, and with cancer 12 million. So basically, if you have two legs, you're probably going to have knee pain. It's just a matter of time. Knee pain is the second most common form of pain. Majority of treatments do not target the cause. Knee replacements can be costly and as well as interrupt your life, and they've doubled in the last decade with the onset of the baby boomers reaching that point in life where their knees are wearing out. They've doubled in number, but you don't have to live with it. So we're going to listen to a patient who's talking about their knee problem.
My knees, I have degenerated cartilage, so trying to walk upstairs, walk downstairs, forget running, that wasn't, and exercise. It was hard to exercise with the pain in my knees. It's a lot better. I've been going through injections with the Supartz and the physical therapy as well, and it's helped tremendously. I'm on my 4th round out of 5, and in my left knee, my right knee is worse, so I'm still working in therapy with that one, but it's doing a lot better, much better. I like the aspect of working with the team because they all seem happy. They love working here. You can tell because the morale is nice. It's uplifting. They're making people feel good.
So like Elaine, a lot of people will have knee pain on both sides. We call that bilateral. And what are the common causes of this type of pain? Mostly due to something called osteoarthritis. Osteoarthritis is the wear and tear arthritis that will happen to the majority of us as we age. Also, if you played sports or any type of contact sports or anything like that, which led to ligament injuries, this can speed up the osteoarthritic process. Bursitis and tendonitis. If you have foot problems, so avid runners can also develop knee pain, whether you overpronate or oversupinate. Posture problems can definitely cause knee problems. Everything gets transferred down to the weight-bearing joints, which include the knees, and systemic inflammation. So if you have an condition such as diabetes or an autoimmune disease where your body's in a constant state of inflammation, this can also propagate or quicken the amount of osteoarthritis building in these weight-bearing joints. So symptoms of knee damage, well, the most common symptom, of course, is knee pain. And then we'll see swelling coming along with that, and then restricted mobility. Some of the most common things that I hear from patients is after sitting for a long period of time, such as like in the movies, it's very hard to get up. So restricted mobility, just can't get around as well. Knee osteoarthritis can develop for many years until there maybe not be any symptoms, and that's when something definitely needs to be done. As the cartilage starts to get more damaged. So how do we find what's causing your knee pain? Well, taking a detailed history and doing a complete examination is part of the process of finding out what's causing your knee pain. We can also do things like x-rays. We can see the development of arthritis on an x-ray. And if we need to, we can do a more detailed exam, such as an MRI, to see if the source of the pain is coming from an injured ligament or tendon. So here we have an example of an x-ray of what a normal knee looks like and what an arthritic knee looks like. So the normal knee, you can see the spacing of that knee joint, how it's nice and big and wide. And then on the right side, we have the arthritic knee, and you can see how that inside, on the left-hand side of that x-ray, how the interior compartment is starting to collapse. And that's the typical scenario that we see. The medial or inside part of the knee is what gets damaged much quicker than the outside of the knee. So some common treatments that some people may try to get their knee pain under control are anti-inflammatories, painkillers, drugs like prednisone, also total knee replacement. But what are the side effects? There can be some dangerous side effects from using drugs long term, and knee replacement with any surgery, you're always going to have a risk. So the NSAIDs, or the painkillers or anti-inflammatories, can lead to bleeding ulcers, GI problems, kidney damage. Any drug that you take long term is going to affect the body. And 107,000 people per year are hospitalized for the excess use of NSAIDs. And over 16,000 people can die from the use of NSAIDs. So people are still saying, but the relief is temporary. It's not a permanent solution, and there has to be a better way. And this may be something that you've thought about.
I've been playing golf for about 25 years, and I have chronic knee stiffness and pain. So I was researching on the internet, and it seems that there's a new treatment, so I thought I'd give it a shot. For the last 5 weeks, I've been getting treatments, and it's been going really well. I've started playing far more effectively, and I've noticed that after the rounds, my knees aren't near as stiff, and I don't have pain. The team's been really fun to work with. It's not like a hospital environment, so when you come in, everybody greets you, everybody knows your name, and over the last few weeks, I've got to realize that it's quite a great practice.
So that's Denny, one of our successful patients who went through our knee program, and like he was saying, he plays golf at least 3 to 5 times a week, and he's done really well. So what's the best way to treat knee problems? Well, a multidisciplinary approach is best. So our practice, that's what we specialize in, is bringing together all these disciplines to get your problem fixed as quickly as possible. That way you only need to go to one place. So it's frustrating when you have to do one thing at one doctor's office, another thing at another place, and you're running all over town. We try to offer all of that in-house under one roof. One of the critical components is getting that joint fluid therapy replaced. So hyaluronic acid is one of the components that we use to help that. So if you want to think of this joint fluid as sort of the oil of the joints, and as we age, we start to lose this. This is a fluid that our body will normally make, but due to injury, time, degeneration, aging, our bodies will lose the ability to create this fluid. So then we inject this natural replacement into the knee itself. So as we lose this, this is what can lead to the osteoarthritis, or that wear and tear type of arthritis, inflammation, and pain. So this joint fluid therapy replaces this fluid to slow down the degenerative osteoarthritic process. It reduces pain and inflammation and improves mobility. Something exciting that we've used here recently is regenerative therapy. So we're using what's called platelet-rich plasma. So this is where we take your own blood and spin it down and get the plasma, the platelets, out of the blood. And what this has shown to do is this part of the blood has growth factor. And essentially what it does is it helps assist in wound healing. So this is a great tool to use for those who may have not gotten the best results just by using hyaluronic acid only. We have found that combining the two, we actually get the best results. So by using your own platelets, we give the chances of helping this problem much better chance in leading to the healing and actually regenerating the tissue. And again, this will maximize the results by using your own body's fluids, your own body's plasma and platelets to help this process. Another thing that we use here is laser therapy. So lasers are being used more and more in healthcare. The type of laser we use is for pain. So lasers are great because it's outside the body, so we don't have to invade the body. It's safe. There's no drugs involved. It's not invasive. There's no side effects. And we have found that this has also helped speed up the healing process. So you probably have heard me say several times, speed up the healing process. So that's what we're focused on, is doing everything possible to use as far as technology or treatments to help speed up the healing process. This also reduces the need for surgery. Back to the platelet-rich plasma, these types of treatments are being used with our elite athletes. So the Tiger Woods of the world and Kobe Bryant's, they're all using this type of therapy along with laser therapy to help their problems and help their careers and make them more efficient and get them back on the playing field or the court as quickly as possible. Here's an example of what the laser therapy looks like. So the therapist is applying it, and you pretty much just sit there, and it's comfortable and non-invasive. What does laser therapy do? It stimulates the cells to help improve the healing process, reduce inflammation, reduces pain, stimulates nerve function. So we use this type of treatment also for neuropathy. It increases blood and oxygen to the tissues, promotes faster wound healing, reduces scar tissue development. Our fourth component is rehab. So implementing rehab is also an important part of the process. So as we get that cartilage to cooperate more, then we want to strengthen the muscles and stretch the ligaments that surround the knee. So we work with you with a very knee-specific type of protocol, and we also give you exercises that you can continue at home. So this is an example of some of the stretching or manual therapy that's done. So here's an example of one of our therapists doing manual therapy on a patient. So we're very targeted to the specific area to help promote healing to that area. We also use knee bracing. So bracing helps stabilize the area. So as a joint ages, it starts to lose some of its stability. So we use some very flexible knee bracing to help promote normal alignment and mobility, and to also slow down the degenerative process. Anti-inflammatory. So we use a natural form of anti-inflammatory. Inflammation is the root cause of knee pain and damage. Injuries and arthritis destroy the cartilage that protects your joints. In our program, we incorporate supplements to help reduce this and keep inflammation down to a minimum. Our knee program combines the best treatments available to provide fast relief. So our target is to reduce pain, reduce inflammation, improve mobility, and get you back to doing what you want to do. Our whole goal is to get you results. So as our gift today for joining our webinar today is I want to open up the lines and offer you a free consultation to the first 20 callers. So for the first 20 callers that are interested in seeing if you're a good candidate for this type of treatment, please call our office, or you can get online and also schedule an appointment, and we'd like to offer you a free consultation, which includes visiting with a doctor, getting an x-ray of your knee if we feel that's necessary, doing a computerized analysis of your motion and strength to see what's going on with your knees.